Hello, I'm Dr. Alexander Day, and I have here at Steinway Family Dental Center. We get a lot of questions about all-on-4 dental implants. So today we're going to answer some of the most common questions that we get about all-on-4 dental implants. And the first question we have is, what are all-on-4 dental implants? Well, all-on-4, meaning the entire jaw, let's say, let's call it an upper jaw, or implants are only supported by 4 implants. So the entire amount of teeth on the upper jaw, let's call it, supported by only 4 poles, 4 screws, 4 implants. And that's why it's called all-on-4. If you need the same thing on the lower, then that would be could be also all-on-4. But that would be on the opposite jaw, right? What are the pros and cons of all-on-4s? So the pros are is if you don't have enough space for more than 4 implants, then the entire jaw could be resting only on 4 implants. And this is the pros for to have the all-on-4 dental implant. The cons are, of course, it's better to have more implants and better support. So it depends on how much bone you have. If you have the entire jaw to be replaced by teeth, then all-on-4 is for you. The next question is, who are the candidates for all-on-4 dental implants prosthetic device? Well, the patients that are missing teeth, if the missing teeth are on the entire jaw and all the teeth are not good, that they need to be extracted, then such a person would be a good candidate to have something that's called all-on-4 dental implants, right? So people who don't have teeth on the entire jaw would be a candidate for all-on-4 dental implants. The next question is, when will somebody not be a good candidate for all-on-4s? Well, if you're only missing 1 tooth, you don't need all-on-4s, right? So those are the patients that don't need them. They're not a good candidate for it. The other aspect would be if there's really not enough bone, right? If there's not enough bone for all-on-4s, or if somebody is taking medication that affects bone healing, like, for example, there's a group of medication called bisphosphonates, or somebody who's taking osteoporosis medication, right? That is the group of medicine, bisphosphonates treat osteoporosis. So medication like Fusamax, that would probably be contraindicated in all-on-4s. The next question is, what steps are involved in all-on-4 procedure? And the steps that are involved, you're going to meet with a surgeon who's going to do the surgical part of the treatment, and you're going to meet with a restorative doctor who's going to do the restorative part of the treatment. Sometimes it is the same doctor. And what they would do is probably prepare a prosthetic device for you, or they would place the implants first, and then you would get video scan, as well as the 3-dimensional scan, and all of that goes to the laboratory, and in the 24 to 48 hours, they would fabricate the prosthetic device for you that will go immediately on your implants. The next question is, what anesthesia option would be available to me in doing all-on-4 dental implants? And the answer is, if local anesthetic is sufficient. Some patients are very scared that they would like to be put to sleep for that. Then yes, that also is possible, but for you to be asleep completely, and the procedure is done under the general anesthesia. But most of the time, it is absolutely not necessary. The procedure is not that difficult to tolerate, so local anesthetic, and you could be comfortable through the entire procedure. The next question is, how long does it take to heal from all-on-4 dental implants? And the answer is, the soft tissue, of course, heals really fast. In a couple of weeks, you're going to heal. The bone takes about 3 to 6 months to really firm up. And that's how long it takes to heal completely. That not to mention that you can get prosthetic with that. The prosthetic device could be done immediately, right? Whether it is temporary or permanent prosthetic device. The next question is, how do all-on-4 last? Well, generally speaking, we do them because we hope that they will last you until the very end, whenever that is. The next question is, what is the cost to receive an all-on-4 dental implants? And the prices, it varies by the amount of work that the surgeon has to do, the brand of the implants used, and the expertise of the doctors that are doing them. So with that said, the approximate cost is about between $37,000 to $57,000 per arch. The next question is, will my dental insurance help with the cost of the all-on-4 dental implants and the restorative procedures? And for the most part, the insurance company don't want to cover that at all. The next question is, how can I schedule my appointment to discuss all-on-4 dental implants? And you can give us a call here at Steinway Family Dental Center at 718-728-3314, or you can go online on alldentalneeds.com and request an appointment with us online. And somebody will get back to you, and you will have your appointment, and you'll come in for your consultation, and we will discuss your personal case with you. So I hope I've been able to shed some light on the all-on-4 dental implants. So those are the questions that we had so far, and we'll look forward in the future to see you and help you with your case.